Okay, so the other one I did today was a CT-guided biopsy. It was a biopsy of a renal mass on a mass of the kidney. This is actually a little diagram of what it looks like when we do lung biopsies. I do these too, but I didn't find one that shows a kidney biopsy, so I'm just going to explain things on this. So basically, we use the CT scanner here to find where the best spot is to go in on the patient. We mark that spot off. We clean it, drape it, make sure the area is sterile. We're obviously gloved and masked and stuff like that. We've got lead on to protect us from radiation. And then we give the patient some freezing, and we start using the CT scanner to gradually guide a biopsy needle into wherever the tumor is. So in this case here, it's into this lung nodule or lung cancer. And it's the same idea as the other biopsy, where we take samples of it and then we send it off to the pathology lab. And these can be a little bit riskier because typically we're going into sort of organs or areas that can have complications. So for instance, the lung can collapse. So the patient can have trouble breathing. With the kidney bleeding, you can hit an artery that can bleed fairly briskly. Usually it's just a bit of a hematoma that stops expanding on its own. Just as a typical complication of one of those biopsies. Hitting an artery is a bit more unusual, which I've never done, thankfully. And other things, you can sometimes, there's other important things around some of these structures, like the heart is close to the lungs, it's between both the lungs. The aorta is pretty close sometimes when we do these biopsies, so it's a little bit more high risk, but obviously you train and you practice and you make sure you're safe, and first do no harm is something that we take very seriously. Okay, so this is the CT guided biopsy. So the patient's kind of in a strange position. So this is his spine. So that's his back, the skin on his back. This is the skin of his sort of right flank, right side. And here's his right kidney. And this is the mass that we're trying to biopsy. And you can see here, this is my freezing needle. And I'm going to scroll through the images. It's going to look like I'm jabbing him a million times with a needle, but that's actually not what's happening. Just the first needle was painful because that's when you put the freezing in, so that stings and burns like a bee sting, as I tell them. And then afterwards, you'll see some sort of longer freezing needles as I freeze down, and each of these images is sort of taken stepwise inside the CT scanner until I finally get the actual coaxial needle, which is a hollow needle through which I insert a biopsy needle that's on a gun, and it snaps in and takes pieces of this 3 times, and then we send it off to the pathologist to find out if this is a renal cancer or not. Oh, and one other thing, you may be wondering why on earth I am putting the needle in the side of the mass as opposed to dead center. So there's a good reason for that. So this mass is actually cystic and solid, and it's a little bit hard to actually see that on CT, but this patient had an MRI. And this part over here was actually more cystic, and this was the solid sort of enhancing part, meaning that there was blood flow to it that sent IV contrast to that part of the mass. So you don't want to sample the cyst wall. You ideally want to go for the more solid part of the mass, because that's if there is cancer in this, it's probably going to be in the solid part of it. So that's why I intentionally went for this part of the mass. To try to get a proper sample, and I'm pretty sure I did because I got cores of tissue as opposed to just little sort of scant little bits of tissue that are probably cyst wall and stuff like that. So hope that makes sense. I'm not this bad a shot. I can pretty easily get right in the middle of something like this, but there is usually a method to my madness if you notice me doing things in a peculiar way. But I thought I would add that onto the end of the video so you guys can understand there is a little bit more nuance to some of these things. Sometimes that's maybe not immediately apparent without a proper explanation.